Hello, my name is Jane Barrett, and I'm just delighted to be moderating this very important webinar today. The title is Life Course Immunisation, Moving from Campaigns to Health Systems. And this is part of the Global Public Health Week and World Immunisation Week for the World Federation of Public Health Associations. We have four excellent speakers, eminent speakers with us today. And what we're going to do is have a conversation with all of them. So first, I'll just briefly introduce you to each of the speakers, and then we'll dive right into the questions. In order that I'll be asking some questions, Professor Stefania Maggi, Research Director of the Aging Branch, Neuroscience Institute, Italian National Research Council in Italy. Welcome, Stefania. Next is Bear Ullman, Executive Director of the European Specialist Nurses Organisation in the Netherlands. Welcome. Pablo Estrella Porter, Preventive Medicine and Public Health Resident and PhD student, University of Valencia, and most importantly, the Chair of the Junior Doctors Network for the World Medical Association. Thank you for being with us, Pablo. And next, Nancy Durand, Associate Professor, Department of Obstetrics and Gynecology, University of Toronto, Canada, clinician affiliated with the Sunnybrook Health Sciences Centre. So welcome to you all. And this webinar is really exploring how immunisation across the life course can be embedded within health systems by linking science, policy and delivery platforms across generations. So I want to move first of all to Stefania Maggi. Stefania, really in your work in gerontology and ageing research, and the relationship between prevention and healthy ageing. And you're here to help us understand why life course immunisation in the context of demographic and healthy ageing is so important. So from your perspective, with all of your background, how does population ageing change the way we should be thinking about immunisation policy?
Thank you, Jane, for this question, because it allows me to start saying how significant is the demographic change in determining how policy for immunization should change with the demography, because we have really to shift and to change the paradigm of pediatric vaccination to a life course immunization, because and therefore to change from an age approach to an aim, a target of protecting the vulnerable people in our societies, and how to maintain the health and their resilience. So we know that older adults are, of course, affected by immunosenescence, and therefore they have more severe outcomes after an infectious disease that might be prevented with vaccinations. And we have to address issues such as hospitalization, exacerbation of chronic diseases that are already present in these people, incidence of new events such as cardiovascular events, myocardial infarctions, and therefore we need to focus on these most vulnerable people and to use vaccines that are designed for them. So it's also an issue of changing the procurement systems and to use enhanced vaccines such as adjuvanted vaccines, high-dose vaccines, the mRNA vaccines that we have seen work also very effectively in older adults. And we have to change also the way we look at the cost effectiveness analysis of vaccines, because it's not just the cost of the vaccines that we have to take into account, but we have to take into account the impact on the use of healthcare systems, such as the hospitalization, the increased need of healthcare utilizations by these people. So again, we have to change from the age target to the setting target vaccinations. For example, in long-term care facilities, in nursing home, we know that the target shouldn't be only the residents because of their age and their vulnerability, but also the healthcare practitioners and all of the staff working in a nursing home should become target for specific immunization. So it's really a major shift from the pediatric immunization with a target age, with a more comprehensive approach and to identify immunization as one of the strategies to promote health and protect health of the most vulnerable.
That's a really terrific scene set because, you talked about really very particular vaccines for, high risk populations, vulnerable populations, as well as the whole process. So we not only have to change our mindset, we actually have to change our systems thinking about who we're targeting. And on that point, I'm just going to go to Nancy, because Nancy, you know, your experience is closer to clinical practice, program management, service delivery platforms. And Stefania was talking about long-term care. And it's such a difficult area to ensure vaccines get in people's arms. So what role do you believe that primary care and long-term care settings play in adult vaccination?
Well, really, primary care providers are vital, and we have to expand our idea of who primary care providers are because that's changing. It's not just general practitioners and family doctors. We have many different types of people delivering primary care, including models like nurse practitioners in many countries, midwives in many countries. But then we also must remember that when it comes to immunization, specialists can also play a huge role. So someone like myself obviously can play a huge role in the vaccinations that would be the types of patients that I would see, like an HPV vaccine, but internal medicine, including respirologists, dermatologists, those who see GI disease, infectious disease. There's all sorts of people who need to understand the integration of immunization. We've gone one step beyond that in our country and in many other countries where we're starting to think even beyond those types of healthcare providers and expanding vaccination to all types of providers, including pharmacists, dentists, dental hygienists, the dental team. Many patients do not have access to primary care. You know this, Jane, in the province in which we live, about 40% of individuals don't have access. Many of those people, though, will see their pharmacist and many will see their dentist at least once or twice a year. So a collaborative approach to immunization as we age with consistent messaging is vital.
You talked about integration, and I just want to lean into that and talk to Pablo. Pablo, you have a very important job, being the chair of the Junior Medicals Association for the World Medical Association. So I want to talk with you a little bit about what are the operational barriers, that countries face in adult immunization. How do your colleagues see this and the association?
Of course. So I would say that this varies a lot from country to country, but we still see that overall adult vaccination is still structurally secondary in many systems. We see that childhood vaccination is usually budget, schedule, and monitor as core routine care. But we also have as healthcare professionals to change this chip and also see that immunization is not just talking about children, but also the adult vaccination has not to be treated as an add-on of the childhood vaccination, but we have to see it as a core component. It's true that also adults have fewer obvious delivery platforms than children. And it's true that over the years, we've seen that we've been trying to improve, and some countries have actually made some great success on this. But still, the delivery points across of the life course immunization for using healthcare system encounters are needed, especially on adults. So in practice, many adults are missed because vaccination is not built into the chronic disease follow-up, the antenatal care, the occupational care, the long-term care, or even the routine primary care reviews. So it's not just like the opportunities missed, which is a great concept also to explore and research how many opportunities missed are happening already in the healthcare systems and the structures that already are out there, but also how we are measuring this, because what evidence shows is that the data systems are still weak, especially across adulthood, when we're trying to gather information, what's the current situation of different vaccine coverage, especially when we compare with childhood vaccination. Then something really important when we talk about vaccination is that one of the main indicators for getting a patient vaccinated is if their healthcare workforce is recommending it. And we see that we still have a long road to go on the workforce readiness and coordination on the vaccination encounters. So we need to make sure not just on the policy side that we have new recommendations that are up to the evidence, but also that when vaccinations are available and offered, how they are actually recommended through the workforce that encounter the patients. And probably the last thing that I would like to mention as a barrier is also these behavioral barriers are a real thing, and we should not overlook them, because we see that in data on research that many cases when we see coverage, we just see like the picture of a whole population, but we're not seeing the subtle barriers where we see in specific populations, in minorities, which would be at higher risk of certain immunopreventable diseases. So we have to be aware that behavioral barriers are also real, and that when we implement research, we have also to take them into account so we can actually act both from the policy side, but also in the implementation side, especially as junior doctors. I think we are in a key moment where we are still in our training, and we should also be aware that regardless of the specialty we're doing, the field that we're working, vaccines also play a key role on the human health overall.
Well, thanks, Pablo. It's interesting that both you, Stefania, and Nancy have talked about the person and the setting, and also the entry points and the missed opportunities in the system, in countries where pharmacists are not able to vaccinate, for example, or whether it's not part of the way of thinking or the system incentivization, dental hygienists. So I want to feel more hope, Bea, when I come to you. So talk to me about policy frameworks in Europe that are actually implemented and have success, because you represent, a workforce of healthcare professionals that are known to be vaccinators. So give us some positive sort of end to this part of the conversation.
Yeah, thanks. It's a very complex question. Where does policy and politics come into to the end result? There are many initiatives in the EU Brussels environment on vaccination, and I'm close to a lot of them as participant in engagement in activities at Parliament level, or at the European Commission, but also at alliances. So beside also the public, also the private domain. But we have overall we have a shared concern as nurses towards these initiatives, and I'd like to elaborate a little bit on this. So I might
please do.
take a little bit
Please
of a
do.
turn on this.
Yeah, please do.
On this. Still, well, let's start with COVID. It seems for many far, far away, and it's not. The health professionals are still getting this sense of fear. Oh my God, that what happened? They a lot of health professionals have not recovered yet, but we also saw a lot of health professionals stepping out of health because of the paralysis, what came over us on this aspect. So health was not a safe environment; it was a dangerous environment, and we were not prepared. So if we talk about immunization and vaccination, we always never should forget this COVID. And I look at Pablo, I look at Stefania, and also at Nancy. We lost a lot of colleagues, not only from the job, but also in life or disappointment. So it was impressive. So that was a really, really step up just to engage in these kind of activities. Also, as we speak now here. So that's also we also need to remind that this is the first start. Yeah. Okay. What during that period, nurses find themselves not as a part of the puzzle because it was mostly handled by the microbiologists, by the pharma. So that's why they fell out. And now our organization and many other organizations, they say, so well, I want to be a part of the puzzle, and that's why we're creating a lot of activities. So the role of the health professionals needs to be increased, and that goes beyond to create a call for action or a position statement. See, for example, like a fire. If there's a fire in a city and you got the fire person, and it doesn't help if the fire person only comes out with a call for action, because it's they who have to do it. So we need to have a lot of debates and activities on this.
All right. Look, thank you for that. And I think what we're also saying is that when we talk about trust in vaccines and vaccination in the general population, well, healthcare professionals are part of that population. So we need to pay particular attention. And I'm not convinced that we are doing that well there. But I want to actually just flip the conversation now in a different way. And for a long time now, I've been just questioning about where immunization just fits. It just seems to hang somewhere in public health, but it doesn't kind of fit neatly into prevention. And I just want to float the idea with you, Stefania, knowing that you've done a lot of work around Mediterranean diet and exercise. And, you know, should we be talking to government about, you know, the package of prevention, which includes immunization? What are your thoughts about that?
Oh, yes, I'm very convinced about a sort of package to promote healthy aging. I don't remember who said something like in the 20th century, vaccinations help to save children's life. In the 21st century, we aim to have vaccination to promote healthy life and to add healthy life to at older ages. And I think it is very important because we now have also some pathophysiological knowledge on top of the observational epidemiological studies that tell us the fact that vaccines not only help in targeting a specific pathogen, but vaccination really promote the functioning of the immune system in general. And they decrease the risk of systemic inflammations that is characteristic of many infectious diseases. So decreasing the systemic inflammation means that they help in decreasing the acute trigger to chronic diseases. But we have nutrition and physical activities that we know are lifestyle factors that decrease the baseline vulnerability to chronic diseases. So combining physical activities and nutrition, we have a lot of studies showing that we can decrease up to 40% the risk of chronic diseases such as cardiovascular disease or dementia. And we now have evidence, of course, that vaccination can decrease the risk of cardiovascular disease by 30-40%. They can decrease the risk of dementia, and we have a very strong evidence now from quasi-experiment data for herpes zoster, for example, that decreases up to 40% the risk of dementia, but also pneumococcal vaccine, flu vaccine, pertussis vaccines decrease up to 20-30% the risk of cognitive decline. So if we are able to think about how the synergistic effect of diet, physical activities, and vaccination can produce health, can really promote healthy aging, I think we have both epidemiological evidence and pathophysiological evidence that they would definitely help us in. The problem is that we should really integrate vaccines into the health promotion, disease prevention, and also in the diagnostic and therapeutic pathways of disease.
So you've given us the science. I think one of the challenges that we have is a workforce. So I'm going to go back to you, Bear, and say, okay, we see immunization fits very neatly into a prevention package, but if the nurses are really often the front line in terms of education. Does your profession have any more bandwidth for this? You know, how would you feel about this? You know, the broader prevention strategy. And, you know, let's be honest about this. It's they have many tasks already during their day. So what are your thoughts? You know, put yourself in the minds of your colleagues and what would they be saying?
Yeah. Well, I think it's good that Stephanie is touching these issues as the contextual, the broader approach in health promotion and immunization and the vaccination. And speaking of these programs, we have in Europe the new heart plan. We have also a new INI report on cardiovascular. And it's very crucial to have in these reports mentioning vaccination as a key element for prevention, and that they don't come automatically into this. We have to get engaged with the MEP, with the rapporteurs, with their team, and that really requires activation and get them in contact. So that you have to spend hours on this. So I really agree that it has to be more contextual. And on education, I think the nurses are indeed, well, we call them often frontliner, but I'd like to use the word more first line as front line is more too much militant, but more first line, because also if I look at Pablo, they're also the first line. We are very much especially in the primary care, and so the doctors and the nurses are going hand in hand in this. On the education, I have a very clear position on this. As I said in my earlier intervention, nurses like to be a part of the puzzle. But being a part of the puzzle doesn't mean only that they're able to setting the jab. And on this, maybe interesting to know that all nurses in the Netherlands, where I come from, are able just to do the vaccination, but only maybe 10% have the advanced practice, so they also can do the prescribing. And as now we like to expand this ability for nurses to also to be more better positioned on this. For example, as Germany, it's not thinkable that a nurse can do a jab for vaccination, which is a bit strange because we think if you're looking at a nurse in an ambulance or in intensive care, they can do the most complex things. Absolutely. But why not just setting a simple jab? So there's a discrepancy. So on education, I always like to think in 5 steps, and I try to keep it short.
Sure. Yes, please.
But they're very essential. Education is normal. Education, and that's not only education how to set a jab, but also the context. How is a vaccine made? What is it all about? Then the the experience, getting more around, and then the competence. So this is a very 3 element. But then what's very much difficult is the tools, the autonomy to going into a program. And if you're doing an education pathway that is led by nurses. So if you have, for example, a hospital where what they say they like to see that in the autumn, the influenza vaccination campaign runs, start in April, start in March with assembling a group of professionals who say, okay, you're going to do the campaign, you're going to do the education, select 2 or 3 staff members, and then getting this program, but then also give them autonomy.
Sure.
With that autonomy, you make advocates. And that's where you create a kind of a positive, and then the nurses say, hey, I'm a part of the puzzle. I'm a part of the puzzle. I remain in my position. And for example, nurses are, a quarter of the nurses, they don't like to stay too much longer in the profession. So give them meaningful. And when you said on top of the most work, it's just not on top. It's just one of the integrated parts. It's infection prevention, AMR, vaccination. It's one of the key basic things. So never. So I'd like to promote that vaccination is not on top of it. It's just an integrated part. Maybe maybe at the core of the health. And maybe Pablo would agree with this.
Yeah, I think that's very important. And I think you've also reconfirmed, that the nurses want to be part of the puzzle rather than standing on the sidelines. And I think that's critically important as we are asking more and more of these first liners. Nancy, you have a very interesting background, don't you? You sort of, obstetrics and gynecology and you're a frontline worker, but you're an advocate and a clinician. I just want to touch on, we talk life course, but of course we're here today mainly talking about the latter half of life. But what does intergenerational immunization even look like? Is it possible or is it feasible? What do you think?
Well, I do think it is. And I think as all providers, we need to think of especially adult immunization in 2 different ways as a provider. First is we're thinking of it as the benefit to the population, a public health goal where we're going to fill gaps where younger people may not have been vaccinated against various antigens, and think of it really as a multi-age cohort rationale. So children are getting vaccinated for various things, adolescents, and then younger and older adults. But we also want to think as a provider about the individual effect for that one patient sitting in front of us. And here we're thinking about the benefit to adults specifically for a group of vaccinations, not just one, but for a group of vaccinations that, as Stefania said, are going to improve health. And isn't it really our responsibility as a provider to provide accurate and up-to-date information and the opportunity to that patient so that they can make that best informed decision for themselves? I think we cannot forget the value of champions in such ideas about immunization. And there are many examples where champions, not just for young children's vaccinations, but there are champions for older people's vaccination. There's a very interesting example from the United States where a famous football quarterback and broadcaster, Terry Bradshaw, who had won several Super Bowls and was seen every week on broadcasts for football by the general public. So he was very recognizable. And he did a very successful broadcast campaign for shingles vaccine. And suddenly everyone was talking about why they should be vaccinated. And the patient was going in and requesting it. For the vaccine that I work with for cervical cancer, the Australian Prime Minister, John Howard, had a very interesting story. His wife was diagnosed with cervical cancer, and he was a very big proponent at the launch of HPV vaccine back in 2007. He intervened to accelerate the HPV vaccination national program, leading Australia to become the first country to launch a government-funded, school-based, very successful immunization program. We had a similar type of champion in Canada, where a very successful news anchor person who then became elected as a member of parliament was diagnosed with HPV oropharyngeal cancer. We had tried for years to get what we call gender neutral or universal vaccination of boys in addition to girls, but it was not until that person came forward with his own disease, campaigned successfully, that now boys as well as girls are vaccinated in all regions, provinces, and territories in Canada. So I think the power of that, we should never forget the power of champions.
No, look, you're absolutely right. And I think that the power of media, I think that we're not always positive about aspects of the media, but you've just given, three very clear examples. And I do remember John Howard's, intervention, and his wife, who is still with us today. So, I think this does work. But I also know Italy, I can remember there being champions in Italy as well, Stefania. Is that right? And then I'll go to Pablo.
Yes, absolutely. It has been very, very effective in increasing from the general population the request of vaccination. I see the other side of the coin, unfortunately, because sometimes, of course, we are all convinced that we need to increase the awareness in the general population about the benefits of vaccination. But then you might also create an unsatisfied need because people, for example, in the case of the zoster vaccination, didn't know where to get the vaccine. They would ask the GPs, and unfortunately, very often they didn't know where to refer the patients. So we have to be very careful about the fact that education and increase awareness must be integrated with government strategies, regional strategies to increase the offer of the same vaccines that we are promoting.
Yeah. Look, you make a really good point, because promoting shingles vaccine and then there not being the supply, or if you have to pay, which is also really addressing only part of the population. So we come back to talking about systems and how they're all interconnected. So we're going to start wrapping up now, but I have a question for Pablo, and then I'm going to ask each of you, what is your closing message to those that are watching this important webinar today? So I'll be starting off with Bea in the closing messages and going through. But Pablo, I come back to your role, and you wear many hats on this webinar, but you are chair, of the junior medicos. Can you just give me one or two lessons from your perspective about immunization programs globally to inform a life course, because it's not about younger people and older people. We really have to advocate for the whole course. So what are one or two lessons that you'd like to share?
Of course. I think for this, we have to take into consideration the implementation frameworks and how we can reduce friction. So first, we need to start with contact points that already exist and not with the new bureaucracy. So we can already map where people already are meeting the system and how we can improve to make sure that not just children are the ones being vaccinated, but actually throughout these contacts that already exist, we can promote more this vaccination, especially on the adult population. But as well, using every encounter to check status. So as I was mentioning before, this missed opportunity for vaccination, that it's any eligible person that come to a health facility but is not resulted in a vaccination. So we have to analyze more these situations that occur and how we can make the shift. But of course, making vaccination status visible in routine records, for example, is something that in many health electronic systems do not exist. And this is also putting a barrier and a friction on the implementation. And using also other opportunities, such as, for example, co-administration whenever clinically appropriate, is also a great way to improve. And finally, and probably more from the junior doctor's perspective that I've seen, we need to drive closer with research and data. We see that still there's a lot of research missing, especially on the impact that these health campaigns can have. Actually, that's also the topic of my thesis. But we need to make sure that in the 21st century, we cannot be doubting of the effectiveness of vaccines, or if vaccines cause autism. But we see that, unfortunately, this the new discussion, well, probably not new, but discussion that is coming once again. So I think as junior doctors, health professionals, and people interested in the immunization world, we have to drive forward into evidence-based practice, and this should be also our main driver. So we have to make sure that evidence and data is still driving the discussions in policy and in implementation. So probably I would just close this with saying that integration also means that vaccination is not longer an exceptional act, but it becomes a part of the day-to-day care of patients.
Look, you've used this word several times, so I just want to raise it, and it's about data. You know, you've talked about the lack of data, you know, in the adult population. And I think all of us, you know, have at one stage or another said, we don't have the data, you know, age, et cetera, et cetera. And you've talked about the importance of evidence-informed action. And I think evidence-informed action goes to implementation, but it also goes to policy development. So, and I want to see that PhD when it's finished, because I agree with you. The impact of these campaigns, we just don't know. And I think, you know, there are billions of dollars, I'm sure, that is put to these campaigns around the world. So it would be more than helpful. It is essential that we know. So we're going to wrap up now, and thank you for this stimulating conversation. I start with Bea and then I go to Pablo. What's your single closing message for our audience today? You're on mute, Bea.
That's great. I think that immunization and vaccination should be the new normal. It's not special. It's just a part of life. It's a part of your health. We know everything about plastic waste. We don't throw plastic bottles anymore. Just throw it away. We know why. We know about the plastic soup. We see it on the beaches. But we also need to act on immunization and vaccination as normal. We also need to talk about it as normal. But as Pablo just explained, we need the data, because when you know the data, then it integrates into your communication. And that communication should be more friendly and open and more to the new normal.
And I certainly take your point about nurses need to be part of the puzzle, and they have really experienced some of the most severe consequences of loss of life, but also not being interested in being in the profession. So thank you. Pablo, what's your takeaway message?
Yeah, for me would be that life course immunization is also about continuity. So we have to take those great lessons that we've already learned from childhood programs and integrate them into the healthy aging. So we need to make sure that this life course immunization is part of this whole prevention approach and not just an afterthought of how this can fit. But probably we just need to restructure our chip on how we are perceiving vaccines. And probably my last message also for my fellow colleagues working in health is that we actually have a lot to say and a lot of impact, because the recommendations that we give to individual patients has a lot to say on the uptake of the population. So sometimes we feel that these small changes might not have a big effect, but actually they do. And they start with individual recommendation to our patients. So whenever we encounter our patients, probably just trying to think if there's actually a vaccine that can help this patient keeping a healthy lifestyle or keeping healthier, even if they just come for a regular check-in.
And thank you for your leadership. I certainly will be following you and very interested to see where you land in the years to come. So thank you. Nancy, I know you've had a long flight from Canada to Vienna. So thank you for hopping on and being with us today. So what's your takeaway message?
My takeaway is always about practicality. How should a practitioner be able to do this? And we have to change our behavior so that we're integrating these vaccination status when we're asking questions at every visit. We do this anyway. We ask you about your medications, your allergies. Do you smoke, alcohol, recreational drug use? It's very simple to add in vaccination status for various antigens as we age. And we can use this to bundle that vaccination discussion, as Pablo said, to include all adult vaccinations. I think about how successful pediatricians are at doing this. So we tend to use a participatory approach. Would you like this? Where our pediatrician colleagues use a presumptive approach. This year, your child is going to get this. Next year, they're going to get that. A presumptive approach when talking about vaccination is much more successful, and we can certainly learn from them.
I like that presumptive approach. I think this is where we seem to be going off the rails. Give people choice, and they go, nah, not too sure about that one. So thank you for that. Stefania, you have the last word from the panelist.
Yes, I think that from the policy perspective, what I think I would wish to deliver as a final message is that we should learn from countries where things are going better than others. And I think these countries are those where we have implemented national lifelong digital immunization registries that are integrated with the health electronic records. And this is the only way we can improve vaccine coverage, because we can track where the coverage is at best, where we have geographic disparities, and the area at risk and the subgroup of the population at higher risk. And I think this would be a policy priorities that would have a major impact also on the clinical activities and the public health activities.
Look, thank you very much for that. I think that you've really helped us close the loop on this important webinar. And for everyone listening, on behalf of you all, I want to thank each and every one of our speakers today, who I think have really enriched my understanding, and I hope yours too. You've been listening to a special webinar for the World Federation of Public Health Association on life course immunisation, moving from campaigns to health systems. And this is part of their work for Global Public Health Week and World Immunisation Week. So my closing remark is just very simple. Moving from campaigns to systems is not simply a technical adjustment. It reflects a commitment to protecting health at every single stage of life. So thank you for being with us, and we all look forward to the next time. So thank you.